Welcome, everyone. Thank you all for coming. Today, we will explore the human experience of cancer, specifically focusing on body changes and emotional well-being. I do not have any disclosures for this presentation. So let's begin by reviewing our objectives for today's workshop or talk. And I also want you to consider what brought you here today to this particular presentation. And as we go through this talk, I want you to consider thinking of any of these objectives that feel most relevant to your personal experience. So for instance, we're going to be exploring how physical health and emotional well-being together affect the cancer experience. We're going to try to understand the impact of cancer on body image. We will also be discussing coping strategies for emotional and physical challenges. And at the same time, it's hoped that I will be able to give you some takeaways and provide a summary of this very important topic for you to consider as well. And as we mentioned, at the end of this talk, we'll be able to engage in a Q&A. Okay, so moving on. So let's start by understanding the full impact cancer can have on a person's life by looking at a framework that helps us understand these impacts more holistically. So for instance, we do know that cancer affects survivors physically, emotionally, and socially. And the problem is these challenges may arise during treatment and persist after treatment, cancer treatments as well. So the biopsychosocial model helps us understand how different aspects of health interact. It offers a comprehensive understanding of psychological health in cancer patients. Now, the biopsychosocial model was actually adapted for medicine, but they adapted it for cancer treatment and cancer care because of the interaction between the biological, the psychological, and the social factors that we have to consider when we're thinking holistically about care for patients who have cancer. So these dimensions are interconnected, and you'll see that throughout the rest of this talk. It's more about seeing how they overlap, and we'll discuss that as we go along. And there's going to be some repetition just in the sense that to drive home the points that I'm trying to make today in the talk. Okay, so let's move on. I do have a quick question for you though, and I just wanted you to think about this as we go through the talk. Have you ever noticed how a physical change affected your emotional well-being? Exactly. So I know no one can answer at the moment, but I just want you to ponder that as we go through this. Okay, so here's a visual representation of how these dimensions interact. So as you can see here, this was adapted, this biopsychosocial model for emotional well-being in cancer patients was adapted by the University of Washington, D.C. And what we're looking at here is a Venn diagram, as we know. And this Venn diagram means that there are three, in this case, three areas, three circles, but they all overlap and they have something in common. So that's the key point here. We would assume that biological factors mean somewhere, this is what they've come up with, cancer type and stage, treatment side effects, genetic predisposition, for instance, and they've also put in these bubbles emotional responses to those things that I just mentioned, coping mechanisms, cognitive functioning as well. But if we take a look at the second bubble here, the psychological, remember, as we understand it, psychological responses, emotional responses, coping mechanisms, cognitive functioning, And sometimes I guess it's a bit of a stretch, but I think that we could potentially see how these other factors like family and caregiver support, financial stress, employment status may have a bearing on psychological factors. So I can understand that. But under the social, I would particularly put those aspects, those points, and I would also add that social interaction. Not only with another person necessarily, but with the community and reintegration back into society and into the community. But this is not what's on this slide. But the thing that I wanted to bring your attention to is right here in the middle. So the overlap is where they all intersect, the quality of life, like how the biological, psychological, and social affect quality of life, emotional well-being, treatment adherence, and survivorship experience. So if we were to break that Venn diagram down into more specific parts, for instance, we're going to look at the physical effects of cancer and its treatments. What we do know and to keep in mind is that there are surgical impact on the body. So when we think of cancer and we think of the physical effects, we think of surgical impact on the body. What does that mean? Well, it means removing loss of a body part, for instance. It may mean scarring. It may mean significantly affecting self-image and appearance, of course. And then there's also the physical challenges of having a cancer diagnosis in the first place. You know, that puts a tremendous strain on an individual. So what does that require? Navigating complex treatment options and managing side effects. That could be quite extensive. Also, there's nerve damage effects, and which can lead to chronic pain or loss of functioning, making daily activities even more difficult to achieve and accomplish. This is something I'm sure many of you in the audience already very familiar with this, but still it does bear mentioning one more time. And of course, other physical effects of cancer may include body weight changes and mobility challenges. So it could go either an increase in weight gain, or it could be a drastic weight loss, making your daily activities, again, even more challenging, more difficult to manage. So the impact on daily life is really astounding. And it not only affects a person's ability to perform everyday tasks, but it also affects engagement socially with others. And it's sometimes hard to maintain a sense of normalcy. So that's what we wanted to kind of explore today as we go through this. So body image can be a very deeply personal and a concept to have, and in the sense that sometimes it's a very sensitive topic. So I definitely want to approach it with great care. But some of these things that I've mentioned up here may seem a little jarring to people. But it's only, the only reason why I'm mentioning them in the first place is that these are common physical and functional changes that some people experience. So for instance, the removal of a body part, mastectomies, that sort of thing, there's visible or hidden changes. So sometimes there are cancers that people have that aren't visible outwardly, but prostate cancer, something else. But there are other cancers that are visible and people see them. So it can affect body image. So there's also swelling, edema, and that can be quite worrisome as well. I've had clients that I've had in the past who've had some severe edema, lymphedema, and they've had a body part, an arm that's really swollen, or a leg that might be swollen. They can't wear, the clothes have to be changed because the clothes that they currently have can't fit. them for that reason. So that can affect their quality of life and their self-image, body image. Weight fluctuations, I would just mention, go up or down. Significant hair loss, or just hair loss in general. And we'll talk about that in a little bit more detail in the rest of the slide in the talk today. Skin and nail changes, that could include scarring, and that's visible, perhaps. The use of prosthetics, sensory changes. When I say sensory changes, I'm talking about numbness, peripheral neuropathy, tingling, pain, changes in sexual function, and functional impairment, of course, which that's referring to hearing, if you've had surgeries or complex surgeries that affect your hearing, your vision, your speech, swallowing, gait, bowel or bladder changes, and one's perceived disfigurement. So these physical changes can deeply affect how we see ourselves. And I think it's important for us to, when we talk about body image challenges, what exactly are we talking about? So let's make sure that we're on the same page when we try to understand what body image challenges actually means. So body image is how we perceive and feel about our physical appearance. It's very subjective. It can be very subjective. What we do know is that medical treatments for cancer offer hope, for many people, but they also may result in long-term physical changes, which can be very challenging as well and very traumatic. These changes can deeply affect how individuals view themselves and their bodies. I wonder, I don't know if many of the audiences, it's not a live, it's not a sort of interactive program, unfortunately, but if I were delivering this talk in a live audience, I would actually, in person, I would actually ask clients, do you feel that your body image concerns were underestimated or misunderstood? That's something to think about. Maybe you have thought about that, maybe you haven't, but it is something to think about and perhaps try to address. Anyway, certain cancer types are more commonly associated with body image distress. And these diagnoses often involve physical and functional changes that impact body image. So for instance, what we do know is that breast, and they're not in any particular order, but these happen to be the most common body image distress indicators and diagnoses. So breast cancer, head and neck cancer, colorectal cancer, prostate cancer, hematologic malignancies, gynecologic cancers. So let's look at the data showing how prevalent these concerns really are. So what we do know is that in breast cancer alone, 46% of patients or survivors, reported body image distress. And what we also know that 75% of head and neck survivors reported body image distress, while 52% of the general cancer group, that's mixed, the rest of the cancer groups, 52% experienced body image distress. Now, we can imagine that the distress levels for clients or patients undergoing any cancer treatment can be quite high. And in breast cancer alone, it's like making decisions, surgical decisions about reconstruction options, for instance. They can definitely influence your body image. And what the data also reveals is that younger patients often report greater distress when it comes to body image issues. And in head and neck cancers, I'm sure this is not a surprise to many people. There are visible changes and functional impacts, as I mentioned previously, about the speech and the swallowing difficulties due to very, very complex surgeries. So that's not, I would imagine that would be what we would particularly see happening. I'm sorry about that. Anyway, let's move now to the psychological impact of these body image changes. So if you remember the biopsychosocial model, we looked at the biological, and now we're looking at the psychological aspect. So key points to consider is depression and anxiety often co-occur with body image distress. And I'm sure that is not coming as a surprise to many people. And what we do know too is that it can reduce overall quality of life. Now, if you've never had anxiety or depression in your lifetime and you have a cancer diagnosis or diagnosed with cancer, what we do find sometimes is that a lot of people experience those symptoms, depression symptoms and or anxiety symptoms, by virtue of having a cancer diagnosis because of the stress that's involved with having such a diagnosis. And in particular, if you have a predisposition to having anxiety or depression in the past, it sometimes can exacerbate having a cancer diagnosis as well. But there are treatment approaches for them. So in the cases where severe body image concerns rise, we have to also consider other aspects that affect people. For instance, loss of identity. So I hear this a lot. Many people find if they're struggling with body image issues, they might have a sense, especially when it comes to having removal of a body part, let's say. Sometimes there's a struggle in terms of who am I now? I've always had this, and I'll give you an example of a client I once saw who was a mother, and she had her children, and she said, and she had to have a bilateral mastectomy, or decided to have a bilateral mastectomy, and her sense of identity was really about what the breast represented for her, and she felt that apparently, they were nurturing, they were giving nourishment to the children, to her babies, and that's what it signified for her. They were there to help, bring her children into the world healthy. And by her not having them anymore, it questioned her motherhood, her aspect of herself, her role, her identity, one part of her identity. So I can see how this would sort of manifest. Also, some intrusive thoughts about one's appearance can emerge. You have some negative thoughts and negative perceptions about yourself. And there's also social withdrawal or avoidance, which, is not unsurprising either, because sometimes we do see clients are fearful to re-enter their community, see family or even friends. And then there are challenges to your self-esteem and self-worth. That is also quite distressing. And one of the things I like to do with clients is really talk to them about how to grieve the loss of their former self, if you will. And that's a really important part of the recovery, the healing, and also struggling with unrealistic expectations. So those are the few things that I think are really important for us to think about. And you can also ask yourself if you've had any of those thoughts or ideas that I just described in your experience with body image distress. So there we go. There's the question. It brings us to the question. Have you ever felt a loss of identity due to physical changes? And also, what helped you cope? I just want you to ponder that for a moment. Because you can see that when you break it down and try to peel back the layers, you may indeed have some of those thoughts that may have emerged as you've thought about how this impacted you in your life. Just want you to reflect on that for a moment. As you do that, I just also like to share with you a recent survey revealing survivors' emotional experiences. This is post-cancer treatment. So here we can see, and it's a little hard to see the bottom here, but on the right-hand side, 50% of the survey participants reported feeling less attractive after cancer treatments. Over here, we see 42% of participants felt less self-confident. So they didn't feel confident about themselves after having cancer treatments. And 36% avoided intimacy altogether. So it does highlight, these statistics highlight the emotional toll cancer treatment can have on an individual and the importance of psychological support. So these responses here are very common and can vary widely among individuals. So I'm not really going to go over all of them because I think, a little bit of them are repetitive. We talked about anxiety, depression, but I think frustration might be something that you might want to consider as well, because sometimes, a person can sometimes feel a loss of control, loss of feeling frustrated about the loss, feeling not able to do something about it. And I have some thoughts about that as we continue through this talk, as we discuss it a little bit in more detail in the next few slides. So let's now consider how these emotional challenges affect social life and relationships. And this is the social aspect of the biopsychosocial model that I showed you earlier. So if we take a look at the emotional struggles, we recognize that they can lead to social withdrawal, lowered self-esteem, and feelings of isolation. It can be, again, very traumatic to an individual. And again, the question of your identity is brought into I guess the identity comes to the surface, as I'm trying to say, and it's often reshaped by physical changes. So you might feel that you are not the same person externally or outwardly. And you sometimes clients feel that they struggle with their internal self and feel that they aren't the same person. But I always try to do some work around reassurance and reappraisal, just so that people can recognize that they're the same person internally, but the exterior may have changed. We can talk about that a little bit more later. But let's not forget, caregivers also experience emotional stress while supporting their loved ones through cancer treatment. So we also have to be mindful and think about our caregivers and how they're going to cope. And also, as you navigate this area, these things that come up for you and reemerge for you, I also want you to remind you that there are coping strategies available. There are mental health support available to you. There's resources available to you, so that we can ensure that all of those three bubbles in the biopsychosocial model are covered in a holistic way. So that's what I wanted to make sure I emphasize. If we do a deeper dive into social relationships, we also have to understand that the mere mention of social withdrawal from society can really impact our quality of life, because we may become self-conscious. It can definitely impact intimacy in relationships, as we said before, and also navigating societal beauty standards. And that's a big one, because America is like $1 billion industry for beauty standards, and you'll see them everywhere: branding, marketing, and it's very hard to sometimes escape that, especially when you're not feeling particularly good about yourself externally, and you are struggling with body image issues. So this is it's hard to avoid it because we live in a society where we're surrounded by it. And then, of course, let's not forget the importance of open communication. And when I say open communication, we're talking here about trying to maybe have confidence or in sharing how you feel internally, recognizing that this is very, very difficult to even broach this subject in the first place. And I'm not talking about just with mental health providers, but I'm talking about in your communities. I'm talking about starting with yourself. I'm talking about perhaps having a conversation with family members, trusted confidant about how this, body image, cancer, how it's making you feel, what's happening. So if you can think about beginning that process, you're definitely ahead of the curve. Okay. So just wanted to ask another question and have you consider how your relationships, if you have any, have your relationships changed since treatment? And then also, what role did communication play? The same thing I was just describing in the other slide. So I can certainly send these questions to you afterwards if people are interested in exploring these further. Let's just pause for thought for you to think about in your own experience, whether or not your relationships have changed since treatment and what role did the communication about how you're feeling about yourself and or family members play. So I think it's important to hear a little directly from survivors about their own experiences. And I wanted to share these quotes just to sort of give you an illustration, and maybe they resonate with some of you. The first one is, I experienced some body image issues. I am very fortunate to still have my right breast, but 2 surgeries changed it so that it looked and felt different. Second one says, family and close friends didn't understand that I thought I should be thankful for the positive outcome. I was extremely thankful and knew it could have been much worse. But the fact was, my body was different and I was having some trouble accepting it. Makes sense? Valid. Which quote resonates most with you, would you say? And why? Another thought to ponder. Well, these are different types of quotes, and I thought it was important to share. I'm not going to read all of them, but just one or two. I think that I thought it was interesting with this particular quote. I feel very self-conscious about my physical appearance when showering at the gym. Yes, persons in public. Of course, they're beginning to feel a little bit more self-conscious. I'm learning to live without my breasts. And this other one down here, bottom right, is anger. I can no longer have children and I don't have breasts. So these are just a window into some of the struggles that people are trying to cope with. And I'm sure there are many, many more. And I guess the question is, how does one cope with any of this, right? How does one cope with body image in the first place after cancer? How does one cope with understanding the self-perception? Well, what we do know is that supportive practices empower survivors in meaningful ways. So care teams can assist you to help you explore the meaning and importance of the affected body parts. So preparatory work is usually done and offered to clients prior to having surgery. That would be the ideal, to explore the meaning and importance of affected body parts. help patients confront difficulties in viewing their body parts, affected body parts when, post-surgery. Also, being able to perhaps address the concerns about any future changes would be helpful, and really try to prepare an individual for both expected and unexpected body changes. So there's an array of help and assistance out there for you. You can certainly, there's one on discuss grooming rituals and self-care routines, and address reassurance seeking behaviors. I mean, there's an array of various support strategies that we can certainly offer you if you feel that you're you haven't received any of this information or would like to know more about it. We can certainly offer that to you, and in your care teams, they would also be able to do the same thing too. Let's look at some evidence-based interventions that can help. So there are some empirically supported body image interventions out there, and they're extremely helpful. Cognitive behavioral therapy, you may be familiar with that, CBT. It helps challenge those negative thoughts about self-perception and body image. Motivational interviewing, I'm not sure, how familiar you are with these terminologies, but they're in the psychological realm. It really supports patients in coping with recent body image changes, and also by meeting them where they are. So they can be going through a process of trying to contemplate the notion of having surgery, let's say, and when, once they've sort of digested that and feel ready, they could then go through the process of actually going in the action phase where they're ready to actually have a surgery at that point. And then it's, discussing with the client, about readiness, like when they feel that they're going to now maintain and look after themselves and take care of themselves. So this is, it's very important. All of them are important, of course, but it just depends where the person is and what their needs are in terms of what sort of treatment approach would be very effective. Acceptance commitment therapy, ACT as it's also known as, it's under the umbrella of the cognitive behavioral therapies, but it does encourage long-term body image acceptance. It helps the person get to that point of self-acceptance a little bit quicker, using cognitive flexibility and other tools and strategies such as mindfulness skills, that sort of thing. Body image reintegration it kind of normalizes and validates body image concerns with somatic healing, sort of releasing the physical tension and trauma stored in the body. So there are different approaches to that, and you could get someone who obviously specializes in that. Body esteem activities. What does that include? Well, that includes planning appearances. So, gearing up using sort of like a exposure technique, behavioral exposure technique, where you have a person practice trying to prepare for a planned event or having to appear in public, for instance, certainly after having cancer treatments and if they've had body image changes. So that can be very, very helpful to many people. We can certainly offer that as well. Okay. So in addition to therapy, the therapeutic modalities I just mentioned, there are also many supportive practices that survivors can try. For instance, mindfulness and compassion is also important. And mindfulness really is just about learning how skills on how to breathe effectively, using progressive muscle relaxation or body scans to help a person relax. And self-compassion techniques are around, really, it's just involving self-kindness, helping a person feel more resilient, during and after the cancer treatment, but having much more grace and self-compassion towards themselves and developing that, fostering that. And then there's narrative and meaning-centered practices. That's sort of guided storytelling, retelling your life, if you will, life review, and values clarification. So it's helping the person guide away from the physical and focus more on values and beliefs that are important to you, that have really a central meaning to you, and that are going to sort of make you feel validated and empowered in some way. Then there's peer and partner support. So we need structured support groups. There are numerous, many of them in the community. Peer mentoring can be helpful. Maybe speaking to a person who's already gone through a similar experience that you have gone through. Also partner inclusive sessions. So you can bring your partners, you can bring family members, that sort of thing, just to help them understand how, what sort of things they would say to you, how to cope and that sort of thing. And then there's empowered self-expression. And this is really powerful tool as well, because you can use art, you can use music, and in some instances, there are tattooing that some women do after having breast cancer or mastectomies. You can do journaling to help make you, share your thoughts and help sort of get them out of your head, those negative thoughts out of your head, and externalize them. You can even use makeup, wigs, and that's really that's up to the individual themselves, because I have clients who adamantly don't want anything like that. They're not interested in wigs whatsoever. Or you can use head coverings or not. It's entirely up to you. So I would invite you to think about which of these strategies have you tried, if any, and what worked best for you. So this slide, I think, is very important again, because it really highlights culture and identity and what's important to you, especially as we have societal norms, beauty standards that can influence body image concerns. So some people, depending on their culture or how they identify, may not want to ascribe to certain beauty standards, and that's entirely up to them. So this isn't to say that you should, the other slide was talking about wigs and head coverings and so on. And if you don't want to ascribe to that, that's your prerogative. And I just wanted to, emphasize the importance of this too. So you don't have to conform, essentially. But there are certain factors like age, personality, and stage of life, essentially, also influence how survivors cope with these changes. So it depends on where you are in your generational years and what your personality is like, whether or not you choose to ascribe to any of these things. And cultural norms and identity are very, very important. So let's not overlook them. Okay, so here are some practical tips to help you build confidence in your appearance. So practical tips include spending time with people who make you feel good about yourself. Talk to others who have had similar body image struggles. How about seeking professional support when you need it? The literature also indicates that we should maintain a healthy balance of exercise and nutrition, as anyone else would do, right? That makes sense. How about join local support groups if you feel that might be difficult? But in some instances, I've known that some of my clients have joined a support group, and initially they might not want to have their camera on. And in some instances, they have chosen to, and they've worked through that process. So it really does depend where the person is. That's where the motivational interviewing comes into place, and what's important to them. You can always ask any healthcare provider or your healthcare team for any guidance if you're not familiar with this area. And also, what about expressing yourself about wearing different clothes that make you feel confident? Focus on maintaining a positive outlook. I can't emphasize that enough. And I know it's a tall order and it's a lot to ask, but if there's way for you to think about trying to remain positive as well as best you can, that would really help your mental health functioning for sure. And again, the last but not least, recognize your strengths beyond your physical appearance, like the values that we talked about earlier. What's important to you? What are your belief systems? Getting away from the physical, the aesthetic, but trying to focus on what you offer. What are your strengths? What do you have to offer? What would you like to do? So let's summarize what we've covered today. We have covered a tremendous amount of information, and I know that there's so much of it that I try to disseminate it very quickly. But the thing that we want to think about is really how has your body image evolved since treatment? We need to think about that. So the goal of humanizing one's cancer experience is really to support individuals with perceived disfigurement and bodily changes. We also want to validate your emotions, normalize your emotions and concerns, but also promote autonomy and strength and empowerment. So you feel that you're having essentially trying to enhance your quality of life. What we do know is that bodily changes are deeply connected to self-image. They're also connected to emotional well-being and what we've learned today through social interactions as well. So the holistic approach is all three of those segments have to be addressed for us to feel that we're able to function in a world where we feel we're part of it again. And how does one do that? Well, as I mentioned, through mental health services that are available to help assist you. It doesn't have to be mental health. You can more than, if you'd like to go to groups, social groups, it could be a faith-based group. It could be speaking to your best friends. It could be speaking to family members. It doesn't have to be mental health services per se. But we do have certain treatment modalities that I mentioned earlier that might suit your needs. So before we close today, I wanted to provide some takeaways for your consideration. So, as I mentioned, cancer does affect survivors physically, emotionally, and socially. Those are the three things. If anything you were to take away from this talk today, remember that biopsychosocial model and just the physical or the biological, psychological or the emotional and the social aspects, which are all intertwined. Body image concerns are common and can impact self-esteem and relationships. Psychological support is essential for emotional healing and resilience, wherever that comes from for you. In coping strategies, there are numerous of them. Many of them can include mindfulness, which is a magnificent tool to use and to have that skill set for, peer support, and self-expression. This is your opportunity to express yourself in a different way, to restory your life, as it were. And we as healthcare providers and caregivers, of course, play a huge role in survivorship care. Before we wrap up, however, I'd like to ask one final question, if I may. So, what is one insight or strategy you're taking away from today's talk? I just want you to think about that for yourself. Like, what's one strategy that you feel that you can apply to your life today after we leave and we go our respective ways? Just something to think about. And if any of the material that we reviewed today is very upsetting to you or triggering in some way, I want you to, or if it resonates with you on some level, you need to seek, you'd like to speak with a mental health provider, or join a support group, please reach out to us or to your healthcare providers. Let them know if you would like to engage or participate in some form of support, and they will be more than happy to make the appropriate referrals for you. Okay. So I have provided a few resources for you. Fox Chase Cancer Center I thought was pretty helpful. It's Coping with Cancer's Impact on Body Image. So really, I like the way they explain everything and share some practical strategies for real life experiences from patients, clients. Would be really helpful if you wanted to look into this a little bit more. Look Good, Feel Better. It's a charity dedicated to improving confidence and self-esteem in cancer patients. And of course, the American Cancer Society goes without saying. They are an amazing resource for patients and caregivers in the cancer world and would like support or know about groups or even cancer centers in your area. So if you're looking for more support, here are some really helpful resources. Well, that concludes our talk for today. So I just wanted to thank you for attending and thanks for your patience. And I'm happy to take any questions. Well, we're going to normalize that because it is normal actually. Many people do experience that. They do feel numb because it could be perceived as such a shock. Learning about your diagnosis. I would like you to speak with someone just to help you navigate those feelings and those thoughts that you may be struggling with. So absolutely, if you feel that you could comfortable speaking to a provider, I would definitely recommend it. It is normal, but when you mention the tingling, I think it's just the sensory sensations that you're experiencing from the anxiety or the worry or the concern. So I definitely think just go speak to someone. That's something that could be worked through. That's a very good question. I always err on the side of if it's visible, address the elephant in the room. I think I always say to clients, if you want to share, you could be mindful about oversharing, of course, but if it's helpful to share with people, if you're there, if you're at the stage where you feel it's not my fault. This is the side effect of what's happening to me is being on cancer treatments, and people are looking at me and looking at my arm, and it's so obvious. I feel very self-conscious. So if you can choose to ignore it and walk confidently in the world, or you can say to yourself, you know what, I'm just going to address it head on and say, yes, I have something, going on with my arm right now. Do you have any questions? I mean, I really find people actually are that bold and be that open about it, but I definitely think if you have a concern and it's visible, especially if you're amongst friends, you can certainly share that if you feel comfortable, but there's also no pressure for you to. If you feel you don't want to, you're just not comfortable doing it, then don't. Yes, 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 yes. Um, Again, this is something that when we talked about in the talk about open communication, I would just say, if you can, maybe rehearse what you intend to say. When we're trying to guide patients through self-disclosure, I would always say, maybe think about one or two things first. So for instance, if you're trying to speak to your partner about body image concerns, I might start with, getting a general sense of how they feel when they see another person who might have a body image issue. Like, what is your thought? What's your take on that? Or what do you think about that person who has XYZ? Or even if you want to personalize it to yourself, then you could say, I've been meaning to have a conversation with you about how I've been feeling. And I'm really nervous, or whatever the emotions are. I'm really embarrassed about, how I look right now, and I'm worried about your perception might be, but I would really appreciate if you could share with me what you're thinking, because I need to know how to proceed, how to move forward. And I would invite the other person, the partner, then to share with you, get some feedback from that person, like, what do they think? What's been on their mind? What are their concerns? What are their worries? Just so that you have the dialogue going back and forth, not necessarily you sharing everything and then falling on deaf ears, or they're not able to reciprocate. So it needs to be a little bit, you give something, you tell them how you're feeling, you'd like to have a conversation, and then they would hopefully share something back with you. Yes. So as we mentioned, sorry, in the talk, you can decide how you want to present yourself, right? And back when you re-enter your communities, you can decide if you're feeling that there's going to be a day when you're going to have to return to an environment. So if you've had hair loss, or struggles with that, or some other physical situation occurring, or physical body image issue, you might want to, again, I always say, gradually start to face it. So you might want to say, for instance, I'm going to practice, perhaps if I want to wear something on my head, or a head covering, I'm going to practice just taking a few steps outside the house. And if you are comfortable going to the grocery store or something like that, or you can, people, because the question is, people, or if they're going to ask questions, the minute they see you, if they don't know, and they're going to ask you questions about what happened, what's going on, you've lost all your hair. And sometimes they might even immediately say, do you have cancer? Like, very direct. So you have to be sort of prepared for, unfortunately, for other people, when they are a little ignorant to your experience, and just perhaps gradually re-enter, and try to decide if you want to address it head on directly with people. Yes, I have a situation going on, I'd rather not say, or I have a medical condition, I'd rather not say, or you can choose to say it. So it's empowerment. It's trying to remind yourself how much power you have, and whether or not you choose to be that direct with people or not. That's entirely up to you. That is a tricky one, I have to say. How do you try to explain your cancer experience and your cancer journey to people who mean well? Of course, we know they mean well, but they might not have that understanding or awareness that you have. Sometimes you can, sorry, sometimes you can provide literature for them to read, and you can just leave it casually in the room for them to sort of pick up and start reading about your, that give you your experience. If you'd like to kind of step outside of yourself, you can let them sort of navigate it themselves, or you can just say, listen, what are your thoughts about, my cancer? What have you been thinking about it? Again, that's more, not confrontational, but it's more direct. And sometimes that can be a little bit sort of difficult because sometimes people really have a hard time being it, or they have misperceptions about what cancer might mean to an individual. So it really depends on how you choose to approach it. You might want to just share with them, like, read this, because I've tried to explain it to you and you doesn't seem like you're listening. Or if not, you can sit down and have again another dialogue where you're asking them, like, what do you think? What do you think my experience is like? Or I would like to share with you, this is what I feel, this is how I feel. Maybe when you're talking to me, you can keep that in mind so that you can't expect me to do certain tasks around the house, for instance, or go and do certain errands. I just don't have the energy to do that. So maybe give them examples of what the struggle is for you. Yes, directly through us. If you would like to speak to someone from our team, you can contact, we have a contact number, which is 212 731 5806. That's 212-731-5806. We're also, it's psycho-oncology. We're at the Perlmutter Cancer Center in New York City. And there are other onco-psychologists and onco-therapists in other facilities, MSK, Memorial Sloan Kettering, for instance, Memorial, what else? Maimonides, there's so many other places as well in Columbia University. So please feel free to reach out if you have some questions. You can also go directly to the medical team and they will make the referrals as well.